Month 9 of pregnancy. Guys, we are here. We are at the end zone. I'm so glad that you guys are here so we can talk about what to be doing during this final month of pregnancy to both get ready for labor and for baby to come live with you. Now, the first thing that I would encourage you to do if you are 9 months pregnant is to keep movement as a part of your life. Now, I get it. You want to just lay on the couch and you deserve to lay on the couch. But the more that you can, do some prenatal yoga, continue walking a little bit, I think your body is really going to appreciate it and it's going to be helpful for labor and delivery. When people spend too much time in one position, be it at work or just laying on the couch, those muscles and ligaments are not getting the movement that they need. So incorporating movement daily into your life can be a big win. Again, also nap. I'm not saying that you shouldn't be napping, but trying to get some stretching, some movement into your life can be really helpful. Now, many of you are watching this maybe even before month 9 and you're thinking, I'm going to go early, but I am here to tell you to stop thinking that you are going to go early. Yes, you might get a happy surprise that you go into labor a little bit early, but most people end up having their baby a little bit after their due date if they are not induced. Now, if you're planning on an induction, that's an entirely different thing. You want to make sure and talk with your provider about what to expect at your induction. But if you are not planning on induced, you need to plan to be going towards the end of your due date. Now, here we are in month 9, and actually I recommend that most of the necessities are already purchased and ready for this baby. I recommend that you finished your birth class. And the hard thing is that you need to be pretty much ready, but still have a whole month left of your pregnancy. You're like, I'm ready. Let's get this baby out. Whereas you need to think, I'm ready. It's time to relax, add a little bit of movement into my day. But I really need to focus on myself and getting prepared for labor when it should happen, which will likely be closer to my due date than I might wish. It is such a better mindset to not be planning on going early. I cannot recommend it anymore. There you go. Keep going to those prenatal appointments. I know you are seeing them it seems like every 10 minutes, but it's so important that you still continue to go. This is the point in time where they could really catch something off. So make sure that you are going. Again, if your appointments are taking a super long time, see if you can see a nurse practitioner, see if there's a better time of day to make your appointments, that they're more likely to be on time. Talk with those front office staff because they can really help you out and make sure that the appointments can fit into your life because they want you to come to them. And again, if you have super boring prenatal appointments that you think are just a huge waste of time, that is a big win. You are winning if that is the case. A lot of people are not having boring prenatal appointments at this time frame. They're finding problems. So if it's boring, that seems like a big win, even though it feels like, why did I even come to this? I totally understand that feeling too. Around 36 weeks of pregnancy at your prenatal appointments, they will do GBS testing. Now, some providers will let you just swab yourself. It is a swab that goes into the very first part of the birth canal and also your rectum. So just something to be aware of. Some providers do it for you because we want to make sure that we're getting the right spots. And if you are doing it, it might not be the right spot. So that's something to be aware of. If you have questions about GBS testing, be sure and ask your provider. I actually have a whole post on my website about it that I'll link down below, but would you be interested in a video on GBS testing? I'd be happy to give you guys more information on it if it's something that you guys are interested in. Tell me down in the comments. Now, 36 weeks of pregnancy, which is about 9 months of pregnancy, by the way. As providers, we go by weeks instead of months. So this is looking about 35 plus weeks of pregnancy is your month 9 of pregnancy. That is the time frame when you can start to get your cervix ready. People don't talk about this very much, but I think it should be talked about more. I have a whole video on cervix prep. I'm going to link that down below. As a cliff note, it includes primrose oil, dates, pumping, and sexy time with your partner. So be sure and check that video out if that's something you're interested in. If you're having a planned C-section, not important for you, you can skip that video. But I don't think we talk about it as much. And if there are things you can be doing to soften your cervix and make it a little bit more ready for labor, or if you have to have an early induction, I'm here for it, guys. Talk with your provider before you try any of those things, though. They need to be aware and talk about the risks and the benefits because there are risks and benefits to all of those things. Now, I'm hoping that your birth class is already done if you are past 35 weeks of pregnancy, but if you haven't finished it, make sure that that is a priority for you guys. Make sure that you're finishing it up. Some of you might be thinking, Hillary, I still haven't even gotten a birth class in. Is it too late? And I'm here to say, no, it absolutely is not. There's a birth class that I recommend. It just takes 3 hours. I'm going to link it down below. It's also made for couples so your partner can get prepared with you. It really is meant to fit into your busy schedule rather than you fit into the class, like how I taught at the hospital when I worked there. Now is the time to be solidifying those work plans, making sure that you've talked with HR about what paperwork you need to do, or if you need to do it like urgently when you go into labor, which I absolutely hate that we have to do things like that. When you get off, how much time you're going to have off, all those different things. Be sure that you're getting all the paperwork. Maybe designate a specific folder for all of that paperwork and fill it out in advance. Don't save all of this for after the baby's born. The more you can fill in advance, like your name, your age, your birth date, all those different kinds of things, the more prepared you're going to be. The more you can do in advance in that one is going to be really helpful. You're also going to be wanting to talk with your insurance and the hospital and the different copays and how much you're going to be out of pocket. Again, I wish this was totally free in the United States. I think it should be. We should be paying for these babies that are going to build the United States, but currently we are not. So make sure that you're understanding your health insurance benefits and how that's going to apply to your upcoming birth. And get the basics for your hospital bag. Personally, I had the things that I really needed, which was mostly toiletries. I have contacts, so I wanted contact lens solution in a case, toothpaste, toothbrush, lotion, things like that. I had a little toiletry case, and then also my external battery, chapstick, and a hair tie, because even if you have short hair like mine, you're still going to want something to tie it back. But the other things like my take-home outfit, things like that, I added when I was in labor. But I think it's important to have the necessities, because if you were to be at a prenatal appointment, they send you directly to the hospital. You know, you want to make it easy on your partner to make sure that contact lens solution comes to the hospital. That would be really important to me. So if there's something like that for you, make sure that you're gathering it and it's all in one place that they know about. Now, tasks for baby. Now is the time to install at least the base or the car seat in your car, or at least try it. I cannot tell you how many car seats I've had come in the box to the hospital, and then they are like taking it out of the box in the save yourself all of that. Make sure that you've taken it out of the box. You understand the car seat. You know at least how to put it in the car, so that you can quickly do it when you're going home. I do not recommend actually bringing the car seat into the hospital until you're about ready to go home. You can leave it in the car. But understanding the car seat, how to fit the baby in the car seat. I would even use a stuffed animal that goes in the car seat and practice putting the baby in the car seat so that you're ready for it. Honestly, I wish I had done more of that before I had my baby, because a car seat was actually a big hang up for me. I could not get the car seat out of the car. I had a really hard time with the latch. So I wish I had done that in advance, so I was a little more prepared and felt like I could do it on my own, because it was tricky for me. And if it's that tricky for you, you might want to even return the car seat that you bought and bought something else that is a little bit easier. Now, if you're looking for like making sure that you have the baby necessities, I actually have a whole video on the baby necessities that I'm going to link down below. I am here to tell you that your baby needs very little compared to what is on that baby aisle. So don't feel like you need every single thing that your baby's going to need. Like some people are buying the high chair right now and all this different stuff. You don't need that right now. Just get the necessities, and then you can buy the other ones as you see it's time for them. I mean, if you're there and you want to buy the high chair, you can, but I think a lot of people feel pressured to have like everything that baby's going to need in their first year of life, and you don't need that. You can buy them as you go. Again, watch that video for the necessities. They're not that many. Now, hopefully you've been doing this since about 27 weeks of pregnancy, but make sure that you are continuing your kick counts. By this time, you should have a good idea of what your baby's pattern is and how long it takes for them to give you 10 kicks. If you're like, Hillary, I have no idea what you're talking about, grab my kick count cheat sheet down below. It's going to be so helpful, because a lot of providers do not say the right way to do kick counts, or they don't tell you how important they are. So grab that down below. It's going to be really helpful. Now, you might be looking more for the signs of labor, and I recommend taking a good birth class. But if you're looking for the signs of labor, I have a whole video about the signs of labor that I think you should check out. So that is the 9 months of pregnancy. Thank you for joining me for this series. If you're earlier on in pregnancy, I actually have a whole playlist for all of the different months of pregnancy. So be sure and check those out. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.